Welcome to Pharmative Live. I'm Dr. James Partyka. I'm your host. I'm a clinical pharmacist, research scientist, and the founder of Pharmative.com. Pharmative is the first social media network dedicated to your healthcare by connecting patients to healthcare professionals and scientists in order to educate ourselves, to improve our ability to understand complicated information so that we can make informed decisions with our healthcare teams. That's Pharmative, and this is Pharmative Live, coming to you live from Palm Springs, California. Today's topic is we're going to be talking about some new emerging medicines for the treatment of COVID-19 disease. But before we start, we definitely want to thank our sponsor, which is Pride Nation Radio. Pride Nation Radio is the #1 LGBTQ dance music station in the nation. Not only is it great fast beat music for dancing, but also for working out as well. And you don't have to ask me. All you have to do is ask Alexa. Just say, Alexa, play Pride Nation Radio. And you'll start hearing that fast beat of the dance music that Pride Nation Radio is known for throughout the nation and throughout the world. So today we're going to be talking about new emerging medicines for the treatment of COVID-19 disease, which is really some very good news. But before we begin, I just want to start off with some statistics. Today is November 7th, 2021. And unfortunately, over 46.4 million cases in the United States of COVID-19 disease have been documented, with over 754,000 people dying of the disease. As of today, our annual average death rate is still over 1,200 people a day die of COVID-19 disease. That's a horrible statistics. We are in the midst of a big wave. That wave is trending downward. One of the drivers of that wave of COVID-19 disease has been the Delta variant, which is highly contagious. And that's why our first barrier of defense against the virus is by wearing masks, social distancing, and hand washing. That's the best way we can do from a physical barrier of preventing the spread of disease. Now remember, not only do you want to prevent you from getting the disease, but you also want to prevent your loved ones or other vulnerable patient populations like immunocompromised patients out there, diabetics, people suffering from autoimmune disorders, cancer patients, and even our children. So that brings me to my next point. In the United States, we have 3 available, safe, and effective, very effective COVID-19 vaccines manufactured by Pfizer, BioNTech, Moderna, and J&J. So if you have not gotten vaccinated as of yet, text your zip code to GetVax, that's GETVAX, and it'll give you a list of pharmacy and clinics in your neighborhood where you can get vaccinated today. Vaccination is a great way to prevent the spread of disease, to decrease the burden of disease in our community, and to prevent the spread of disease to vulnerable patient populations such as the elderly, our children, people that are sick with immunocompromised diseases. So you want to get vaccinated not only for yourself, but for your family, as well as for members of your community. Get vaccinated today. That is the best way we have, as it stands today, to fight COVID-19 disease. Get vaccinated. That decreases the spread of disease, decreases the burden of disease, decreases the emergence of mutants or variants of the virus that may be even more virulent and more disease-causing. So again, if you have not been vaccinated, take the Pharmative Vaccine Challenge and get vaccinated today. If you qualify for a booster, schedule your booster appointment Remember, over time, the antibodies that you develop from the vaccine do get a decrease in titers, decrease in number. So we need booster vaccines to boost up the antibody levels to make sure that you're at the best place to fight the vaccine from entering into your body, to invading your body. Get vaccinated, get your booster shots. And now, some more good news, Pfizer has a child's vaccine available for ages 5 to 11. So you'll be able to get your children vaccinated as well to protect them from getting COVID-19 disease. Not only is it a life-threatening disease that may require hospitalization, intubation, can even lead to death, but there are long-term complications of COVID-19 disease: confusion, fatigue, neurologic disorders, okay? There are unknown risks of having COVID-19 disease. The best way to fight the disease is to prevent the disease, and we do that through the barriers of masks and social distancing, but we also do it through getting vaccinated. Millions and millions of people around the world have received the vaccine. The vaccine is safe, and the vaccines are effective in preventing COVID-19 disease. I've been vaccinated, and you should get vaccinated too. Text your zip code to GetVax to find the nearest pharmacy and clinics in your neighborhood where you can get vaccinated today. The next part of Pharmative Live, we're going to be talking about some new emerging therapies to treat the disease, okay? If you test positive for COVID-19, the first thing you want to do is self-quarantine, and you certainly want to participate in contact tracing and let the people know that you've been in contact with, that you have tested positive for COVID-19, and that you are self-quarantining. The next thing is you're going to monitor yourself for symptoms of the disease: fever, chills, and loss of taste, smell, and shortness of breath. You want to be calling your physician immediately once you test positive so that you can monitor your symptoms together virtually, or if he wants you in the clinic, that's possible too, although you've tested positive for COVID-19 and you should remain self-quarantine. Now, if you're developing symptoms, the first thing you need to do is, if you're qualified for receiving medicines that can prevent the disease from progressing and to prevent you from being intubated and hospitalized and even possibly death. The first medicine that I'm going to talk about, something that's been around for a while, it's referred to as the monoclonal antibodies, or the cocktail mix. These antibodies have direct effect against COVID-19. You receive them by a 90-minute infusion in a special infusion center clinic. Sometimes they're difficult to access these clinics, so you may need to not only speak to your doctor, you may need to speak to an infectious disease specialist so that you can get access to these monoclonal antibodies, which are available in the United States for national emergency use. Okay? Those are the monoclonal antibodies. They're antibodies. It's an infusion directly given to you that fight the virus directly, almost immediately, to prevent you from getting severe disease. Now, the good news I have is a brand new pill released by Pfizer. The data was just released, so it's data that has not been peer-reviewed as of yet, but is extremely promising in fighting those people that have symptoms and COVID-19 disease. Pfizer, and the brand name of the drug is Paxlavid, and you're going to be hearing a lot about Paxlavid. It's a tablet capsule oral formulation which contains 2 medicines that are very potent antiviral agents against COVID-19, which halts the replication of the virus. So in this study, which was a randomized phase 2-3 study, placebo-controlled, where patients were randomized either to receive Paxlavid or placebo. And that study reported out this past week, and it was found to be 89% effective in preventing hospitalization and deaths. That is remarkable. And all of these breakthroughs that we've been seeing over the last year to 2 years against COVID-19 is all built upon research that has been ongoing for decades and decades and decades of research, which have allowed us to develop different platforms, different formulations, and different approaches, therapeutic approaches to fight COVID-19 disease. And now I'm proud to say that we have a multi-pronged approach between our physical barriers that we have in place of mask wearing and social distancing. We have the vaccines, 3 most safe and effective vaccines to prevent you from ever getting the disease, which is great because if you never get the disease, you never have to worry about the long-term complications, known or unknown, of COVID-19 disease. We have the monoclonal antibodies known as the cocktails that you have access through special infusion centers, which may need for you to require asking for an infectious disease specialist so you can get access to that can prevent you from progressing to severe disease and from preventing you from getting intubation. And now we have new oral antiviral pills, which are likely to be available rather soon. So with Paxlavid, which was developed by Pfizer, which is 2 potent antiviral agents taken together, 3 pills in the morning, 3 pills in the evening for 5 days only. There are some GI side effects associated with it, but you're only taking this antiviral medicine for 5 days, okay? One of the medicines is a protease inhibitor called ritonavir. Again, this protease inhibitor is very effective at inhibiting the replication of COVID-19. The study was halted immediately by the Data Monitoring Committee because it was proven to be so safe and effective. There were 0 deaths in the patients receiving the active drug Paxlavid, and there were 10 deaths in the placebo arm. Again, Pfizer is now intending to apply to the FDA for national emergency use of this medicine, which should be available within a couple of months. I would say December, January of this year. So, if you develop that you're positive COVID-19, you self-quarantine, you monitor your symptoms, you call your doctor, and if your doctor feels you qualify, when this medicine is available as national emergency use, you'd get a prescription for Paxlavid. You will take it twice a day for 5 days, and that will greatly reduce your risk of hospitalization and death from COVID-19 disease. That is remarkable. And if the data pans out, this is one trial, there'll be other trials, but the data is so robust with such a high efficacy rate, the side effect profile is very tolerable, that this medicine is going to revolutionize not only the treatment of COVID-19 disease in the United States, but throughout the world, because it'll be available as an oral pill, which will be easily administered through pharmacies throughout the world. So that's Paxlavid, and I have more good news to share with you. I just wanted to acknowledge Dana out there, Helen out there, Jimmy out there. Welcome to Pharmative Live. We're talking about new emerging medicines in the treatment of COVID-19. The first was Pfizer with Paxlavid, and now we have a second one, Merck, which also developed a pill. The generic name is Molnupiravir. So as a pharmacist, I still have a hard time pronouncing generic names. Molnupiravir. We'll call it the Merck drug, okay? It decreased in its study hospitalization and death by 50%. This is a drug, the brand name is Lavgurio. Okay, so again, These are hard names to pronounce. They're brand new. It's available in Britain, and it's undergoing availability now in Britain. But it is also a potent antiviral medicine. It's a ribonucleoside DNA analog which inhibits and wrenches the replication of the virus. You also take this medicine twice a day for 5 days. It also has side effects. It also is a very potent agent against COVID-19 disease. So, with all of that, we have some really, really good news about COVID-19 disease. We have our vaccines, which are now available in the United States, which are highly safe and effective. If you haven't been vaccinated as of yet, you need to be vaccinated. It's the only right thing to do, and it also prevents the spread of disease to other vulnerable patient populations. We now have several treatments available, including the cocktail mix or the monoclonal antibodies, which you would have to receive at an infusion clinic. Okay, and now very soon will be a new oral pill, either from Pfizer or Merck. They're two different medicines. You take them for 5 days, early onset of COVID-19 disease symptoms. So that's the key. Just like Tamiflu, you have to take quickly if you're diagnosed as having influenza. These medicines you need to take quickly within a few days, 3 to 5 days of developing symptoms to COVID-19 disease. The Pfizer pill has demonstrated to be 89% effective at reducing hospitalization and deaths associated with COVID-19 disease. This is great news. It's great news for all of us in fighting COVID-19 disease. And again, all of this drug development has been done with the pharma and biotech industries over decades and decades of understanding viruses, how to treat viruses, how to develop vaccines, how to develop them quickly, effectively, and distribute them to as many people as possible who want to take the vaccine. And now there'll be a new oral pill, either by Pfizer or Merck, that you'll be able to take if you're developing symptoms to reduce your risk of hospitalization and death if you do develop COVID-19 disease. That's all for today for Pharmative Live. In the meantime, stay healthy, and I will see you next week.